Taylor. I reckon we crack open some cake.
Some cake, some lammies.
So being a relative local here, where are you taking me?
We're going to turn right because it's a one-way street. That's the start. So, you're a physio student.
Mm-hmm. Mm-hmm.
How did your journey inform the decision to become a physio student or become a physio?
How did it inform the decision to come back to uni for the third time? So it all started out, I guess, as an elite junior footballer. I was playing in the TAC Cup, which is the highest sort of footballing competition in Australia. I think it's now called the NAB League. It's a bit of a changer. Anyway, I was playing in that. One pre-season I didn't have a break between seasons.
Right.
So I didn't have that off-season break that you would usually enjoy.
Sure.
Decided to keep pushing on in hope that I could, I guess, ideally
get an edge or something.
Get an edge, make it to the next level.
Sure.
The dream was always to play AFL. So pushed pretty hard. Started to experience some groin soreness, generalised groin soreness, and hip soreness. So that cut my pre-season short. And then from there, we sort of went down a rabbit hole of interventions.
Right.
So you'd start with your usual, you've been through the same thing, your anti-inflammatories, onto more invasive procedures, injections.
People start cutting into you.
And then eventually, it ends with you going under the knife every couple of months for a few years.
Yeah, wow.
Yeah. And so during this time, I was an exercise science student, which I really enjoyed. I finished that and went into 4 years of teaching. Taught for 4 years. And now, so midway through exercise science is when I sort of was introduced to EP, Explain Pain.
Yeah, okay.
That old book.
I'm
sure you've read it a few times. The Bible.
The book that changed our lives,
The book that did change our lives. It was a bit intimidating introducing those guys last night.
That's
being
right.
some of my idols. So got through reading that and then reading more resources around pain neuroscience education, or now neuroimmune science. Became obsessed and fascinated. At the time I was studying teaching, and I was also teaching, but I didn't really have an interest in the content in which I was teaching.
Yeah, okay.
So the passion was always with pain and helping people experiencing less pain. So I thought the best way to do that would be to go back and study physio.
Yeah, okay.
So now I'm in third year. I'd like to think eventually I'll end up teaching at Monash University physio.
Sure.
That's the goal.
Yeah, okay.
To try and work on changing some of the curriculum to become more in line with what we are delivering down here in Tasmania.
That's pretty cool.
Yeah. Taylor, you have a pretty similar, really similar, we're the same age, so really similar story to mine.
Yep.
Give us a lowdown on what you went through.
So, I was quite successful early on in my rowing career, so my background is in rowing. I went overseas a few times in the Australian junior team. I won a bronze medal in the Junior World Championships in the single scull. It was quite promising for me, had my eyes set. So this was in 2008. I had my eyes set on going to London. That was it, 4 years later.
Yeah, nice.
My hips had other plans.
Yeah.
So basically I had femoroacetabular impingement. For those that don't know what that is, it's basically a bone on bone causing my knees not really to come to my chest without my back moving. If you're laying down. So
what you need when you're rowing.
You need lots of hip
deep
flexion.
in the hip flexion, yeah.
That's right. You need lots of hip range of motion, and if you're applying lots of power with your lower body in lots of lumbar flexion, even though we know that lumbar flexion is okay, but lots of loading in that is not necessarily okay, especially over long periods of time.
Yep.
My first pain experience well, maybe the bilby that overflowed the bath for me was a squat.
A squat.
But as it is for many people, I'm sure, the old squat gets a bad rap sometimes. But then it was a longer term thing than just one thing that set off the fire alarm, I guess. So basically, what ensued was 2 hip surgeries to increase my hip range of motion. I had bone removed from the neck of my femur and edge of my hip socket, the acetabular, and then rehab back to greater progression. Red explained pain prior to my hip surgeries, so I was well on the way to educating myself about how pain works, and at the time I was also doing exercise science at university and enjoying it. I rehabbed back to a decent level. I've been attending selection regattas still, but wasn't quite there. Had another big sort of upset, another sort of pain experience that wasn't so fun. That lasted, descended into sort of chronicity again after a few months, and that lasted a while. And I sort of came out the other end of that after having an intervention. It was a facet to innovation, but was that justified?
We'll never know.
We'll never know. The end result was the fact that I was able to get my head around it and then progress back to being quite successful again. Well, finally had been faster than I was as a junior, and then went on to go overseas and compete again. Had another injury and then had to retire because of that. Now, I finished my exercise science degree around the time I finished rowing. I didn't really know what I wanted to do. Did I want to continue down the path of that the rabbit hole of prescribing exercise? Talked to some trusted people around me and went down the path of becoming an exercise physiologist because I wanted to help people, and I help people.
Yep.
And with whatever I did, and my experience with pain along that journey would probably help people best in terms of the physical journey as an EP. So
yeah, for sure.
That's me now. Can you describe? This might get a bit emotional, but we'll both share this.
All right.
Can you describe
deep.
what was it like in the depths of?
Right at the bottom.
Yeah.
Basically.
Yeah.
I reckon this answer will probably sound pretty similar to yours. So I, up to that point, had always associated my identity with being this footballer, with being an elite athlete. Absolutely. And that's how people knew me.
Absolutely.
And so that's all people would talk to me about. So when obviously that pain experience, eventually I spent about 3 or 4 years where I played one game and it wasn't looking so great for me. I felt like it stole my identity.
Absolutely.
Yeah.
Did people always come up to you and be like, their way of trying to break the ice was like, how's your hips or how's your groin?
Oh, I couldn't go and watch the teams I was listed with or signed for. I couldn't go and watch them play games of football because I wouldn't actually get to watch the game of football. I'd have a line of people wanting to, like every time I took a step, another person would come up and we'd have to have the same discussion over and over again about where I was with my rehab, and the answer was always about 4 to 6 weeks away. I've just had this injection, I've just had this operation.
Absolutely.
Same conversation over and over.
Feels like a broken record.
It does.
And that can really, that in terms of the lowest points for me is that was pretty difficult. As well as doing that though, you realise, it makes you realise who your real friends are, in terms of from people that were around at the start of your journey and at the height of your, I suppose, sporting achievements, and then when you go down deep and who still sticks around. That's
yeah,
quite
for sure. And also on my part, I locked down So in my mind, the way I was going to get better was if I essentially slept, ate, rehabbed. So I wouldn't go out, I wouldn't socialise, I wouldn't talk to my friends. Because like going out, have a kick, go and play some golf, going out for dinner out to maybe a club or something like that, I considered that.
Not necessarily.
It wasn't, it was going to hinder my rehab.
Yeah, I know what that's like.
So essentially that's what I spent doing for a few years, just sleeping, eating and rehabbing. Probably the same as you?
Yeah. It's
there you go.
Yeah, it becomes, you cut away all the things that won't, don't seem like they'll get you to where you want to go.
Yep.
Is that necessarily the smartest thing to do? Probably not when you're in the depths of pain.
Yeah, in hindsight, that's
like
the absolute opposite.
That's right. You're taking away all the sins. You're taking away all the safety in me.
Using the people around us who do love us, do support us, and going out and having fun with friends, and doing the things that we crave as human beings.
Yeah, that was a definite part of my existence.
Yep.
I don't think. I was trying to think of the amount of parties that I went to when I was doing exercise science compared to when I was doing exercise physiology.
Just not having fun.
Yeah, you just don't go out.
Just not enjoying it.
Because you think that. Yeah. But not only that, you feel like sometimes some of them, it's like, I can't go there because it's going to hurt my back as well, or like you limit yourself. You're in this little box.
Oh man, like if I had my parents ask me to mow the lawn, I would just.
Yeah.
I would not be happy about that at all. And I'd push around that lawnmower around the backyard, walking like a crab.
Yeah.
With my perfect form.
Yeah.
Like,
stiff as a board.
Stiff as a board, walking around the backyard.
Yeah.
And then that 20 minutes mowing the lawn, I'd have to go and rest, of course.
Yeah.
Because that wasn't beneficial to my rehab.
Exactly, yeah.
And also I was dealing with I was pretty decently medicated.
Yeah, okay.
In terms of like Lyrica and gabapentin. They're horrible drugs. They are terrible drugs.
I didn't progress to that. Oh, actually, the old prednisolone.
Prednisolone.
Yeah.
There's a reason so many cyclists abuse prednisolone. It's good for one thing. That's recovery between training sessions.
Yeah.
Works a treat in that respect.
Interesting times on prednisolone.
I get the old moon face.
Share it, a little bit. Oh, I didn't get a heap of swelling, but I did get. I was really phased out, like really spaced out on prednisolone for some reason.
Oh, really?
Well, it's a reasonably heavy medication. Stuck my thumb in the end of a Baymix, one of those stick blenders. There's a story that you won't hear.
Yeah, wow.
I was just like, why did I do that? But that was during a week of pretty heavy medication. Makes you do funny things.
It does. And the thing was, I had this background in anatomy, physiology and whatever, so I was able to go to a sports physician and I could talk them into essentially giving them whatever I wanted.
I'm going to do a quick U-turn here because we can't go that way because we end up on the highway. And then
we're doing a U-turn.
We're doing a U-turn.
So I got really good at doctor shopping. Would doctor shop for interventions, for drugs, for the works. Not really opioids. Didn't really get stuck on any opioids other than post-surgery.
Sure.
Lyrica. Gabapentin, which they were terrible drugs.
Far out.
I remember trying to teach on these things and it'd feel like you hadn't woken up until after midday.
Yeah, wow.
And then finally this haze would lift and you go, I taught this morning.
Yeah. So now that we've spoken about what we've been through, how do you reckon that's going to change how you practice as a physiotherapist if you were to, you've done a little bit of placement, but in terms of the next year and a bit, I think, correct me if I'm wrong, how's that going to change when you talk to people that come in with chronic pain?
I think it sort of boils down to treating the person in front of you and not their particular pathology or not their pain.
Sure.
Treating the person, trying to identify any of those psychosocial factors and using like a multidisciplinary team when it's required,
Good answer.
And I think the most important thing is just great exposure to valued movements that they want to be doing.
That's very
the
well
key.
put. I think that's something, if I was to answer that same question, is something that I emphasise as an EP, is trying to look at the person as a whole. I've written a few just to start off with, and they want, make me better, and they want me to write something on a piece of paper that's miraculously going to make them better. We find out what some quality movement looks like for them. It's really basic sort of stuff, and they're like, oh, but that's really basic.
Yeah, like Jack was saying last night, sometimes it is really basic what you're prescribing.
Absolutely, it is basic.
It's common sense.
Part of the time is to trying to some sort of clinical trickery to make someone realise that they can move in that motion. Like, let's say it's a particular getting out of a chair without looking like you're a robot, or pushing up off your knees because you think your back's going to give way or something. Trying to find out what it is and how it's going to make it click for a particular person. But what I was trying to say is that I just on one day or a few days a week, just have fun and put a smiley face, because that's part of the thing, and that's something that I had. We'll just go around one more block to finish this.
We've got to keep going
because we're not
done yet, guys.
We're not quite finished. We're just going past the motel, so that's why I had to say that. But because that's something that went missing, and you just become such a serious person and you don't smile.
Yep.
And to try and find something, what a lovely waterfall on that hotel.
That's pretty nifty.
That is a nifty waterfall. Didn't even know that existed.
That is a bit fancy. I'm not going to say it's better than our accommodation.
We let it
probably slightly better than our accommodation. I think we hop under there and do like a Friends opening scene sort of reenactment.
Yeah, herbal essence as well.
Oh.
Could get a bit of that happening.
Wow.
We're going to go straight ahead here, I think. Something to actually get them thinking about what is a sim, I guess, that they haven't done in a while, that to just try and counteract some of the dims, I guess, in their life. So that's something that I do. But in terms of just the sharing of my story with clients or patients, depending on what you want to label the people that are walking through your door, I've found just gives people hope, and you can see a weight lift in some people and think like you've been through this. I'm like,
stories of recovery.
That's right.
Obviously, I was in the book Pain Heroes by Alison Sim.
Yeah, wow.
It's a fantastic book with 10 stories that are really similar.
Yeah.
And I think with us, or with myself and Taylor, the thing, because we're so young and at the time we were both elite athletes, we're not the general population who you expect to be going through these pain experiences.